Albinism by Connor Clark
and Carson Midas. What is albinism? Albinism is an inherited genetic condition that causes the body to produce less melanin in the hair, skin, or eyes than normal.
The probability of being diagnosed with albinism is different between different areas of the world. In the US, it's very rare. In Nigeria, it's way more common. In Tanzania, it has the most concentration in the actual planet, with a 1 in 19 rate.
Types of albinism. The most common type of albinism is oculocutaneous albinism. It affects the skin, hair, and eyes. The second most common type of albinism is ocular albinism, which only eyes lack melanin. Albinism is also referred to as hypopigmentation.
The inheritance pattern for OCA albinism, or at least OCA albinism, or ocular albinism, is X-linked or linked to an X chromosome. It is also a recessive mutation. Any other form of albinism is not linked to any chromosome.
How effective is albinism and how do you test for it? Albinism is not very effective and is quite rare, but it is possible for a baby to be diagnosed before birth if the couple has had a child with albinism before. Doctors remove cells from the placenta during the 10th to 12th weeks of pregnancy in a process called chronic villi sampling to test for the disorder.
The signs and symptoms for albinism are usually, or at least the signs, are usually self-diagnosable from visual or eye problems, as well as any noticeable skin tone aberrations. The symptoms are different between different people. The white or extremely pale skin, hair, or eyes is usually common between all types. Some words are much easier to get, patchy skin or skin color, and if the condition is more serious, vision problems, blindness, crossed eyes, or rapid eye movements.
How do you test for albinism? Genetic testing is usually the best way to diagnose albinism accurately. However, this is more helpful only if your family has a history of the disorder. However, the diagnosis can also be as simple as just looking at your eyes, hair, or skin and seeing if any of the symptoms of albinism. There are other tests that can be done to your eyes or hair cells to test for albinism, but they are not as accurate.
Albinism can affect people's life, but it can be treated. Albinism usually doesn't affect your lifespan, but people usually diagnosed will be limited in what they're able to do outside due to them having more risk to sunburn or any other damage. If their condition is more serious, though, they could have seeing problems, blindness, cross-eyed. Testing is usually, or treating at least, there is no cure for it. However, you can use sunscreen when going outside, wearing heavy clothing to protect you from the sun, and wearing sunglasses for light sensitivity to your eyes. And that's about it.
Bye.